We're now going to demonstrate hoisting a patient up off the floor after they've had a fall. They're in a good position in terms of the environment, so we've got enough space around us, but if they weren't, we could use slide sheets to move them into a better, more spacious area ready for the hoist. The patient has been assessed as not being injured, and it's always a good idea to follow any risk assessment that is within the property with any special considerations for the patient, and always carry out your dynamic risk assessment. So we have a sling to use when we're hoisting up off the floor. This is a Oxford Jones sling, and we always do safety checks on equipment, make sure there's no damage to the loops, for example, or the edging, or rips and tears to the sling itself. So to start with, we're going to roll the patient. We're going to apply half of the sling, roll them back, and then bring the other half of the sling out, which will demonstrate that to you now. So, can we bend your knee, put that hand over, hand up there, looking that way, and a roll. Thank you. So we're putting half of the sling on. So we've got the shoulder strapped here at about shoulder level, and we've got the hips at hip level. We then need to check where the spine is and make sure it's in line with the centre of the sling. So I'm just going to feel for the spine. We've obviously gained consent from the patient that we can touch them before doing anything. I'm just going to bring a little bit more over. It's important to do this with the sling so that once we've lifted a person up in the hoist, we've got equal amount of distance either side of the sling. Otherwise, we can have a bit of an uneven lift. So from here, we're going to roll the hip part and push it under the hips as far as we can. And same again here, we're going to roll, pushing under the shoulder, but also trying to feed this strap here through under the neck area. And then from there, the patient rolls back onto their back, and on the other side, my colleague will start unrolling the sling from her side. I'm just going to bring that leg up through the leg there. So the first thing we need to do here is cross the legs. It's really important to cross the legs for dignity and safety purposes. We then thread the hip straps through the leg straps, and then I'm going to get the hoist. When we're using a hoist, whether it be hoisting a person or getting them up off the floor, it's very important to do our safety checks with the hoist. So we're checking that the Lola sticker is in date, we're checking that it works, we want to do a little test run, we're checking that the emergency lowering system works okay, we've got an emergency stop button in the back, and we also want to make sure that that battery is full of charge as well. The last thing we want is for the hoist to suddenly stop in mid-lift. This particular hoist is a MIDI. This is a MIDI, and the safe working load is 180 kilograms. It's also important to know what your safe working load of the slings are, which are normally around about 200 kilograms. When manoeuvring the hoist, there are two options that you have here for coming in towards a patient. Ideally, you don't want to be coming in from the head end because of the risk of injury to the head. So you can either come in from the foot end. One issue with coming in from the foot end is that you would need to assist the patient in lifting their legs over the mechanism of the hoist. So there is a bit more of a risk of injury to yourself because you're having to manually handle the patient's leg. I would always recommend coming in from the side. So I'm going to come around this side because there's a bit more space. I'm going to open the legs because I can. If you can't fully open them, it doesn't matter too much. I'm going to ask the patient if they can just bend their knees. That's it. we can assist with that if needed. And I'm just going to come through the legs. So if you weren't able to open the legs, it wouldn't matter too much. You could come in as far as here, and then potentially you could widen a bit more, and then maybe even widen a bit more again. But I'm coming in as far as I can to get that spreader bar as far in over the chest as possible. Just going to move the pillow a little bit. So bringing it in as far as you can go. You might want to use a pillow here under the legs if that's a little bit uncomfortable. But once you're in this position, one thing I need to say is that you never apply the brakes of the hoist. You always keep the brakes off, because once the patient starts lifting, you will see in a few minutes that the hoist will move as the centre of gravity moves. So from here, I'm going to first of all attach the leg straps. And the reason I'm doing the leg straps first is because if you were to start from the shoulder straps first, they're in a much more strained position for a longer period of time, and there's more strain for whoever's supporting the head for a longer period of time. So I would always start from attaching the leg loops on. So we're going down. Depending on where you're going, you would attach certain loops. Today we're going into the chair, and we're going to attach the longest loop on the legs. So the longest loop would go on this little clip here, which is the closest clip to the legs. And then if I can come in a bit more, I will try. Move this pin a bit more, that's all right. I'll move it like that. So I think that's about as far as I can go. I'll see if we can go down a little bit further. That's as far as it goes. Each hoist that we have in standard stock does move to a different height, and the legs do open to a different width, so it's good to know. So from here, the hoist is as far in as possible. My colleague is going to get behind the patient with the knees under the head and just moving the knees in to try to support the head as much as possible. And we're going to try to get whichever loop we can get on, which in this scenario is the longest loop. Okay. So the longest loop isn't ideal for sitting in a chair, because when we hoist, we're going to be in quite a reclined angle. But I'm going to show you a little adjustment you can do. So making sure you've got really good communication, talking to the patient, reassuring them, try to encourage them to put their hands across their chest if they can. And what I'm going to do is I'm just going to change the position of this one here, so there's a bit of a twist on it. Taking your time. Okay, checking the straps, the loops, and then we're going to start lifting. So we're still supporting the head, because there's a lot of strain on the neck here. You'll see the hoist is moving now quite a lot, and the patient starts lifting up. You might want to support the legs here, so I might want to come around here. If you've got a third person, then you might want them on the control whilst your colleague is helping with the legs. So we're just going to go up a bit further. We've got the chair ready behind, so as we're going up, my colleague will grab the chair. Okay, so rather than moving the hoist, which is very heavy and can also put the patient at risk if they start swinging in it, it's always better to bring the chair in if you can. So from here, we're not going to be pulling on these straps, because that pulling can put our musculoskeletal system at risk. We're in a position here where we're really quite reclined, but that doesn't matter because I'm going to show you an adjustment. So we're going down in this position, just being careful of this chair, slight tip there. We're just checking everything's okay. And I'm going to move the hoist away as soon as I can. So to get a really nice postural position in the chair, what we're going to do is change these straps to the shortest one. Okay, see if we can get the green one on if possible. Okay, and then we're just going to do a little lift, and what you'll see is you'll see the back straighten up, then the lift will occur, and we would basically go back down at that point. So we're just going up, checking everything's okay. So you'll see the back, the hoist move then as well. So you'll see the back moves upright, and then the lift starts, and they automatically swing back towards the back of the chair in a much, much nicer position. My colleague's just about to push on the sling here, which is another really good way of getting the bottom back in the chair. You don't want to be touching the knees or the hips, just pushing on that sling there is a really good safe technique. And we've also got a lovely fab stance there as well. So going all the way down, watching that spreader bar, push the hoist away as soon as we can. We're in a really good seating position now. And then as soon as we can undo the loops. All right, let's take the hoist away. And then from here, we're just going to take the sling out. So we take the hip straps out, undo those leg straps, and then to remove the sling, all we're going to do is just fold back the edge of the legs of the sling and rolling it out against itself. You can use those slide sheet mitts for this, that would be really helpful. We'll do the same on the other side. So rolling that against itself. Okay, and then if the patient can sit forward, then we're just going to take the sling away, and we're in a really nice seated position in the chair.